Hello, ladies and gentlemen. It's nice having you all here again. Sequel to my last video where I said I encouraged a guy who is HIV positive to inform the lady he intends to get married to. So I and my colleagues, other doctors, we had some arguments and some back and forth. So I decided to just put it out here. This one is for everyone to weigh in and for doctors as well to weigh in. So the question is this: if you are a doctor and a male patient of yours comes in and he is HIV positive, but he has refused to inform the wife or he has refused to inform his girlfriend, is it right for you as a doctor to tell his wife that he is HIV positive? For instance, you are consulting and you're seeing the man and you ask him, are you sick? Are you this? Do you have HIV? Do you have this? Do you have that? And he tells you, no, I don't have any of that. But from what the signs and symptoms he has, you feel he has a condition. Maybe he has HIV or something like that. Then suddenly, maybe the patient tells his wife or his girlfriend, please help me and get something outside. Immediately, the wife goes outside or the girlfriend goes outside, then he says, doctor, I am HIV positive. I don't want my wife to know yet. So the question is this: under this condition, do you think you should tell the wife that the husband is HIV positive? Some of my colleagues said it is wrong. You should not tell the wife. It is breach of patient-doctor confidentiality. While some of my friends, they also quoted another um, practice rule which says you don't allow someone to do harm to other people or to do harm to the society. So the question is this: under this condition, as a doctor, should you tell the woman or the lady that the husband or the fiancé or the boyfriend is HIV positive, knowing fully well that he does not want to inform her? So while I was having this conversation with some of my colleagues, some of them said, never. You should never tell them. You should never. That in fact, if you do that abroad, they can sue you and they will seek for damages and that it's wrong. While some said they will go ahead and tell the woman because they wouldn't want the man to infect her and then create harm to her. While some said they will not tell instantly, they will find a third party or they will find a way to indirectly tell the woman. So drop your comment in the section, drop your opinion, tell us what you think. Do you think it's right for the doctors to go ahead and tell the tell the woman or tell the fiancé? Okay, so for me, this is how I will handle this. Before I state how I will handle it, I would want every one of you to put yourself in the position of that woman or in the position of that fiancé or that girl. If you are the one and you are dating someone who is HIV positive and you are not aware, and maybe he has not infected you yet, or he has infected you, because under certain conditions, most men will, or even women, will infect their spouse while they themselves are taking the antiretroviral drugs, while their spouse will eventually develop AIDS and die while they are still alive. So if you are the one, would you want to be told that your spouse is HIV positive so that you can at least start taking your drugs or you can make tests and all the rest? Okay, for me, there is something we call patient-doctor confidentiality. It's a condition, it's a situation or a rule where what a patient tells you, you don't share it with a third party, no matter what it is. And my own argument is this: under no condition should you tell the wife that the husband is HIV positive. Under no condition. What you can only do is to sensitize the husband. Tell him the reason why he should tell the wife. Encourage him to tell the wife. What are the reasons, or why should he tell the wife? One, if he tells the wife, he will get what we call family support. He will get what we call family encouragement. He will get what we call his community around him will encourage him, will support him. Even if he doesn't take his drugs often, his wife will keep reminding him to take his drugs. That is number one aspect. And then the number two, the psychological aspect of having to hide that you have such a condition from your family, from your spouse. It's very, very dangerous. It's not something a doctor should encourage the man to do. So I would lay out all the points available, encourage him why he should tell the wife, try to appeal to his conscience. When I mean appealing to his conscience in a professional way, making him understand that this is someone he loves, and then for him to love the person, it's also important for him to care about the person, to also protect the person. So he should inform the person. But if he chooses not to inform the person, I myself as a doctor, I will not go behind his back to inform his spouse. Neither will I go behind his back to inform his girlfriend or whichever person it is. But there are certain conditions under which you can divulge a patient's medical condition. One, if the patient is unable to make sound decisions for himself. Some people might just come in and they have trauma, they cannot talk. You have to tell his family members what is going on in his life and all the rest. If a patient is maybe under drug overdose, or a patient is unconscious, or a patient becomes psychiatric or has psychosis or psychological disorder, and he's not able to make the best judgments for himself. Under those conditions, you can divulge the patient's health conditions to his family members. But if you see that the patient is sound, he can make sound decisions for himself, he's okay, and he does not want you to inform his family members, you have no right to inform them. You have no right. That was my own side of argument. But my colleagues, some of them said it's wrong. Some of them said you have to inform because you cannot allow some. One of them gave me an instance. He said, if you see someone who has a disease or infection and is likely to spread that infection in his community or spread it to people around, that there is a law that's in health practice that entails that you have to prevent that person from doing that. So doctors in the house, even non-doctors, health workers, drop your own idea, drop your own suggestion. What do you think should be done under this condition? My name is Dr. Wilson Joshua, and it's nice having you once again on my page, on my account, wherever you're watching from. Have a lovely, nice day.